Let's face it, getting and sustaining good health. In your 40s, 50s, and beyond is not easy. Wouldn't it be great if you could discover the latest cutting-edge procedures and treatments for optimum health and vibrant living all in one place? Problem solved. This is the NexGen Health and Wellness Podcast, where we talk to local doctors and practitioners from around the country who specialize in integrative and regenerative medicine to slow the wheels of time for their patients. We find out their stories on how they are making a difference. Welcome to the NexGen Health and Wellness Podcast. Now, your host, Steve Champagne.
Hello, everybody. Welcome to today's episode of the NexGen Health and Wellness Podcast. I have Dr. Matt Wilson back again on the show. Welcome, Dr. Matt.
Hey, guys.
Thanks for coming back on the show. I appreciate it.
Thanks for having me. Great to be here.
We're going to be talking about Shockwave Therapy tonight. It's a new procedure that you've been offering. But before we dive into Shockwave Therapy and what it can do for folks and how it's helping your patients, why don't you just give a quick rundown? Tell us a little bit about yourself, if you could.
A little bit about myself. Well, I got two wonderful kids, 6 and 9-year-old boy and girl. Wonderful wife that she's my office manager, works with us, and pretty good life. I'm pretty blessed. We work hard. We have our ups and downs like everybody else, but very thankful for what we have and what we're doing. Chiropractic has been, I've told Steve before, it's a calling. I would have never in a million years thought in high school that this is what I'd be doing. Didn't really know much about it, but here I am. And I was definitely called into it, and it's the place I'm supposed to be to help people and change their lives. And I'll make my mark in history by saving lives. I truly believe that I save lives and getting people healthier and getting their spine and everything to function the way it should.
Okay. So before we get into Shockwave, one more question on your background is, how did you go from what you were doing before to becoming a chiropractor?
I used to race cars with a good friend of mine, and I went into aviation and he went into chiropractic. And at that point, like I said, I never really didn't know much about chiropractic, and hanging around him and seeing the how everyone reacted to him, the whole town knew this guy. He's like, "Hey, doctor, such and such," and I'm like, "What's so special about what he's doing, this guy, or whatever?" And so I just look into it more, and I just was like, "Wow, this is, I'm doing this, and this is kind of cool, but this is like, you're just changing lives. I mean, it's nothing. I've never really seen anything like it." So I'm like, there I was being called right in that moment and didn't realize it. And boom, here I am. So
how many years now doing chiropractic care?
Since 2008. So pretty good while.
Yeah, very long time. All right. So you recently have taken on some new protocols and new services, one being Shockwave Therapy, and that's what we're going to dive into right now.
Yeah.
So first of all, what is Shockwave Therapy? What can you tell us?
Okay. Shockwave Therapy it's a high-powered acoustic wave that fires into your tissues, and it makes millions of little micro traumas in your scar tissue and your fibrosis and where the damage is. And it's actually a good diagnostics tool, because if I'm running it over my arm and there's no problems there, I'm not going to feel anything. But when you get to like the area where the tendon's messed up or something's messed up, it will let you know, and you'll say, okay, there's the spot. And then you work that spot out. And it was probably one of the best purchases, the best device I probably have invested in my life, because people are just going crazy over it. I mean, people can't wait to get in here and do this, and they love it. And I love the reaction they're getting from it.
So can we go a little bit more detail on exactly how Shockwave Therapy works?
Yeah. And so, like I said, it's a high-powered acoustic wave that fires into the tissue, and it makes the millions of little micro traumas in there. And so your body kicks in and it starts making macrophages and stem cells that go in there and start rebuilding that tissue. So it's not just like some type of pain numbing device or something like that. It's actually rebuilding the tissue. And I mean, we're doing everything from meniscus, like I'm doing my medial meniscus right now, working on them, and they're rebuilding. And you're like, how in the world is it? But it does. It's rebuilding tissue. And plantar fasciitis, all kind of things. It just wouldn't believe that it's, that it rebuilds. It doesn't just mask the pain or the symptoms.
So basically, if I understand this correctly, the stem cells are regenerating new tissue, new cells.
Yeah, right.
Okay.
And it's wonderful for, like old injuries. Like say, we got a guy in here that's 45 years old or 50 years old, and he played football and he had some bad injuries back in high school and his knees or his ankles or whatever. It will go in there and break up that old fibrosis, those old scar tissues from 30 years ago, and rebuild it. It just kicks your body back into gear to start rebuilding that tissue, where otherwise it's just not going to do it.
Now, I heard you mention a couple areas that you can treat, but what are the general areas that you can treat with shockwave therapy?
Well, here's the things you can't treat. You can't treat brain matter, and you can't treat the lung tissue, but just about everything. You wouldn't want to do like your guts or anything like that, intestines and stuff, but pretty much everything musculoskeletal you can treat. And the big things that we're treating, elbows, shoulders, wrists, hands, knees, your entire spine. We're working on spines all over the place, working with spines, your feet, plantar fasciitis. It even does things like neuropathy and treatment for ED. So it's a very versatile machine that works everywhere pretty much.
So basically anyone who's suffering from tennis or golf elbow, they should come see you. Okay.
Absolutely.
All right. And now you did mention that, as a way to do some type of diagnostic, and when you get to an area, there's a little bit of pain. How much pain is there involved when it comes to shockwave therapy?
Well, we have the ability to bring that up and down in the intensity level with the machine. So generally we will start out at it goes from 0 to 18 on the pressure wave amount that we can put into it. And we usually start you out at 2 or 3, something like that. And we'll search and find that area that's bad. Now, if it's a really sensitive area, that 2 or 3 can it's lighting me up pretty good. But it doesn't last too long. Once you kind of get in there and work a little bit, it'll start calming down and it starts feeling better. And that's the crazy thing about it. You can have a knee or shoulder, whatever you're working on, hurting really bad. We can work on it for about 4 or 5 minutes with the shockwave, and then we're done. And you get up and you're like, wow, I can move my shoulder. I can squat with my knees, and it feels great. Now, that doesn't mean it's instantly healed. It started the healing process. But it's amazing to me how it makes you feel great right after it's done. I mean, when you walk out of here, you got a big smile on your face because you haven't felt this good in a long time.
Any side effects?
No, not really. You can be a little bit sore. Like I told you, I think I'm working on my medial meniscus on my knee, and that's a deep tissue. So they have different heads that you can go deeper. So I'm going the deepest you can go, 30 millimeters, right down into the cushion inside my knee. And when I first do it, it feels good. But then the next 2 or 3 days, I can tell something got in there and dug around on my meniscus. I mean, kind of like they would do in a surgery. It's not the same as surgery. It's not as, as drastic as that. But I can tell that it's getting in there working, and it just takes some repetitive treatments to keep that healing process going.
Which leads me to the next question. Typically, how many treatment protocols or treatments do you need to, correct something?
The biggest average amount would be 6 treatments spaced a week apart.
Okay.
Yep.
How long does the session generally last?
They're usually about 4 or 5 minutes. So
that's it.
We time it with the number of strikes. So we have the ability to change the frequency of how it goes, pow, 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 like that right there. And we usually have it on setting 8. And we usually want to get somewhere around 2,000 to 2,500 strikes in the area that we're working on. If it's a smaller area, we can do it because usually if you got a whatever area, it's got 2 or 3 areas in there that you got to hit, because it's the pinpoint one is only about the size of my finger, like where it's going. So you're going to go all around those areas, and you want to get around 500 strikes per area that's really sensitive.
Okay. Any downtime or recovery time you said you felt it like a couple days later, but is it just a discomfort, or is it something that you're going to be, limping for a little bit?
No, it's just, and it doesn't happen all the time. Like I've done, I guess some tennis elbow here or golfer's elbow on some, I'm an old guy. I've got sores and stuff too. So it's great that I can try it out on myself because I know that much more about what it feels like with a patient too, of course. But I did my golfer's elbow on both of them. That was real quick and no side effects, no soreness from that. I did some bicep tendonitis from like bench press and stuff like that. And I think really my low back, doing the low back and my knees is the only one that had some soreness a few days after, but it wasn't anything drastic really.
Wow. It sounds like this is the next miracle treatment protocol out there for folks that are suffering from chronic pain. So very effective in treating chronic pain, would you say?
Excuse me?
Treating chronic pain and conditions.
Yeah. It really does. I mean, and it, like I said, it gets to the source of the chronic pain rather than just treating the pain. It's actually getting to why you're having that pain and start knocking that out and healing it. That's what I love so much about it. Cause you can go get like a cortisone shot or steroid shot or whatever, and it may or may not, knock it out or whatever. And a lot of times you'll have soreness from that or some pain from that, but it's still just masking it and maybe reducing some inflammation, but it's not fixing the problem. It's not healing the problem. And this does.
So this is actually repairing damaged tissue and ligaments. Yeah. Okay. Very good.
Absolutely.
We're going to wrap up here. Do you currently offer some type of new special for someone who wants to come learn about Shockwave Therapy?
Yes. We have a $49 special that we're running right now. A lot of you guys will see it on Facebook or Instagram. That's running. It's got some live video that's showing me working on people in there, working on shoulders, on different things. So you can kind of see what's going on with it, know more about it. But it's a great deal and everybody should have anything. You should take advantage of it.
Okay. All right. So I'll wrap up with this, Dr. Matt. If folks want to learn more about it, how can they find out about it and where can they find you?
Okay. Well, at my office in Brandon right now, it's 902 West Lumsden Road in Brandon. Okay. And the phone number is 813-574-9206. You can go to our website at Epic Chiropractic.org. And you can click on and see a whole lot more about what's going on and how it works. I've got a lot of videos on there that we can show you of different treatments and talking about different things that are going on.
All right. Very good. Well, Dr. Matt, again, thanks for coming on the show again. And folks, till the next time, make it a great day.
Thanks, guys. Have a good night. Bye-bye.
You have been listening to the NexGen Health and Wellness Podcast. If you specialize in integrative or regenerative medicine or anti-aging, and you would like to be a guest on the show, please visit nextgenpodcast.com for more information. Thanks for listening.